Great. Thank you so much. So our usual announcements. So we are CalMap. We are available for consultation to medical providers. Folks can connect with our child psychiatrists, psychologists, and care coordinators. We'd love to hear from you. Next slide, please. These are some upcoming events that we have. As always, they're always free and they include free CME credit. We'd love to have you join us. Our educational programming takes a brief hiatus over the summer and we start back up in the fall. And so we would love to have you back for any of our series again, well, later this spring and also in the fall. And next slide, please. We are very grateful to our funders. If you could just go back to that slide. And then we are funded by a number of different organizations and we are really grateful to them. Thank you so much. And so I'm pleased to introduce our speaker today, our very own Dr. Evan Holloway, who's a member of our CalMap team. Dr. Holloway is a licensed psychologist and consults with families and providers of children and adolescents. He has 15 years of experience teaching, conducting research, and providing clinical practice with motivational interviewing, which is an evidence-based substance use treatment. He has years of experience providing evidence-based family-centered brief interventions. And since 2013, he has specialized in improving behavioral health service delivery systems for youth involved in the legal system. He completed a postdoctoral fellowship with advanced training in substance use disorders, treatment and services research, and is developing a program of research focused on secondary prevention of substance use for adolescents. Today, Dr. Holloway is going to be talking about patterns of avoidance and opposite action plans. So very excited for this. Thank you so much for being here today, Dr. Holloway.
Thank you, Dr. Brewitt, and thank you all for being here. I appreciate everyone's presence and coming hopefully during your lunch hour or a little moment in your day. If you are able to turn your camera on, I love to see your faces and love to hear other voices. Yay! Besides my own. So thank you for participating to the extent that you're able to today. So we're going to talk today about how to identify patterns of avoidance and how to work with those, right, to intervene using opposite action plans. I have some experience as a direct provider, but I also rely on everyone's expertise here. So if at any point you have anything to add, lessons learned, please jump in or share them at the end. As Dr. Brewitt, mentioned disclosures, I also just want to say I don't have any financial interests. Whenever people do, I'm always a little jealous. That sounds kind of cool, maybe one day, but I don't have any, so just wanted you to know that. And I also want to thank my colleagues, Dr. Anna Swan and Dr. Allison Libby, who very graciously contributed materials for this presentation. So learning objectives for today is I hope that by the end you will be able to name 2 signs of avoidance, identify at least one way that exposure can be an intervention for avoidance, describe 3 examples of opposite action strategies for disrupting patterns of avoidance, and to feel more confident than you were before you came in about how you could develop opposite action plans for those common avoidance patterns for students and young people that you serve. So I'm going to focus on one common place where you might see avoidance and stress is in the school setting. School is the most common source of stress, or at least according to data. There's a lot happening in the world right now, so that can change over time. But generally, school is always a common source of stress. Evidence shows that about 60% of teens and 40% of children and kids who aren't teenagers yet report that time management of all of their activities is a source of stress, right? There's a lot of opportunities and things that kids can do to kind of keep them busy. There's a lot of benefits to that, but that also can lead to some stress. And so I would like this next. I'd also like you all to think about other types of things that you think students or young people might avoid. So if you're able to, please pull up, you can take a picture with your phone, or you can go to menti.com and use this code 142270028. And I would ask you to enter there some of one or more things that students avoid. And then I'm going to switch screens real quick. And need to find where's Zoom and pull up the other. Where did you go? There we are. Okay, let me pull up everyone's results. Okay, go. Great, we've already got some responses. Talking in class, physical activity, school, crowded places. Yeah, and some of these, I find myself even wanting to avoid some of these now as an adult, but these are great examples. Kids, maybe I'll give another like 5 seconds in case there's any others that come in. But yeah, these are all, I think, common things that kids may avoid. PE, interesting. Speaking publicly, exercise, this is great. So lots of examples, a common thing that we are likely to face whenever we're working with kiddos. Okay, so keep those in mind. Go back to, okay. We're gonna focus on the example of school avoidance, right? And these lessons are applicable to other things that kids might avoid. But school avoidance is more than just feeling a little nervous about the beginning of the year or having some jitters in the morning about going to school. To think about whenever this is causing like some clinically significant problems, you should think about the length of time that someone might be avoiding school, right? It might be common to be a little nervous at the beginning of the year, for example, or coming back from like winter break, moving to a new school, things like that. So considering the length of time and also the function of that of refusing to go to school, why are they saying that they don't want to go to school? Are there other things that are dissuading them from going or encouraging them to stay home, for example? This is different than like a truancy pattern, right? Where we're just saying someone who isn't going really at all. But just kind of wanting to avoid school or things associated with that. This is most common in ages of like 5 to 6 or 10 to 11. Other times of transition, like I said, switching to a new school, or I noticed at age 5 and age 10, right, you might be transitioning from like preschool to kindergarten to elementary school or to middle school. So transitions can be exciting, but also hard. So some of the first things that you want to consider whenever we're thinking about how to address school refusal is, what is the function of this school refusal? Like I said, is this to avoid negative emotions, to escape places where you can be evaluated by your peers or by adults? Is there increased attention from loved ones, right? Even positive or like the best intentions, right, to support or comfort someone could actually be reinforcing or the school refusal. What is anxiety provoking at school, right? So identifying what might be causing that anxiety, how to address it, what has been tried before, and how that's worked or not. What happens when the youth stays home? So, are there video games at home? Is it more comfortable at home, right? If staying home is more comfortable or kind of more fun than going to school, then why would you go to school? How do we differentiate kind of avoiding school generally or understanding if someone's experiencing physical symptoms, might be feeling sick? And then identifying, is there a plan to help support this youth's return to school? If not, then we need to come up with one. All right, so we're gonna do some basic a review of anxiety 101. Anxiety is really important. It keeps us alive. It's what might stop you from walking into the middle of the street and getting hit by a car. So it can be very protective, and it is a response to imminent threat in that example. So the old fight or flight sort of paradigm. Anxiety is more future oriented compared to fear. And so, think about this as apprehensiveness, uneasiness, or nervousness over an impending or anticipated ill or like a negative experience. So like I said, anxiety and fear can keep us safe. So the goal is not to get rid of all anxiety, or experiencing anxiety is not necessarily a bad thing. In fact, it can be very adaptive and effective, but then there's a point where it can start to cause problems. So another way to think about how anxiety works is to understand the relationship between our thoughts, feelings, and behavior, right? And this is the CBT, cognitive behavioral therapy sort of triangle. So what are our thoughts about something like avoiding school, right? Oh, someone's going to make fun of me, or I might say something stupid, or I have a test today and like I'm really, anxious about that because I didn't do as well the last time. And so those thoughts influence our behavior, which in this case would be, I want to avoid going to school, or I want to get out of this situation, where I might expect something bad to happen. And those are associated with some physiological sensations, that fight or flight response, or freezing. And so talking about avoidance more specifically, this refers to behaviors where people are doing something to avoid or to disengage from a certain situation or a difficult feeling, right? So thinking about giving a presentation at school, for example, or even giving this presentation, right? If I were to avoid it, be like, I'm not even going to show up today. And I actually used to not be very comfortable with public speaking. And so I'm going to use myself a little bit as an example of how exposure works, right? Doing more of something that makes you a little nervous is actually the best way to combat it. Okay, going a little bit more into the behavioral part of CBT. Positive reinforcement is whenever we provide rewards because we want to increase behavior. So my 2-year-old right now is learning to say thank you for things. So every time he says thank you or tries to, right, I'm like, yes, that's great. That's exactly right. That's so nice, So trying to shape his behavior over time. It's because we want him to say thank you, more often and be a little bit, well, he's still a little prince, but to be a little, to communicate gratitude is a value of ours. And then negative reinforcement is kind of the opposite, but it works a little bit differently. And so this is whenever we avoid something stressful and we get immediate relief. So that might be if I were feeling anxious about today, which I wasn't really. But let's say I was feeling a little nervous about presenting today, and I just was like, oh, I'm gonna call out sick, or I'm gonna maybe say I can't do it at the last minute. I might feel immediately better. But then that would introduce other thoughts. Oh, well, maybe I have other things I need to do today, or will people, believe if I come up with an excuse or something like that, right? Negative reinforcement then is this sort of can introduce a cycle where it increases this avoidant behavior. Think like, oh, I felt better the last time I avoided it, right? And I didn't have the opportunity to really test some of those thoughts about how bad it would really be to present. And so what happens is this gets us into this cycle where anxiety gets stronger and can have more of an impact on our behavior. So it's really important to be careful not to reward avoidance, right? And so that means, making sure that there are not more, it's not more fun, right, to stay at home versus going to school. And this doesn't mean that you should make someone miserable or like make it so uncomfortable that you're introducing more distress, but more thinking about things that might be motivating, a kiddo to want to stay at home. What's fun about that, and trying to address that balance a little bit. All right, so I already previewed a little bit exposure, which is just to and how that works with anxiety and avoidance. So orienting you to the left, as I said, many things can cause anxiety, but avoidance is what helps maintain that. So if there's an anxious situation, excuse me, might feel physiological symptoms of anxiety, um, you know, being a little dizzy, short, sweating, for example, right? So you might avoid that situation. And in the short term, you feel better, but you don't actually learn any skills to handle that situation or to test what some of your assumptions would have been, right, about how distressing the situation would have been, like going to school, giving a presentation, for example. So exposure therapy helps to stop this cycle of anxiety. We support students, kiddos through practice to help them face their fears bravely, validating like, I can see why you might be anxious, but we're actually going to do something about it instead of avoiding. So doing an exposure is a key ingredient in effective cognitive behavioral therapy for youth anxiety. Let's look a little bit more about why exposure works. So it helps build mastery and confidence. Someone actually experiences the world differently than maybe what they would have expected. Sometimes it's consistent with what someone might expect, right? I'm nervous about going to school because I'm going to get bullied. You actually are getting bullied at school, right? And that's where just doing exposure without, doing other stuff to support students isn't a great idea either. This is just one part of your toolbox. Exposure also helps prove anxiety or the thoughts, that are worrying you. It can prove them wrong. You can have other evidence to say, actually, I didn't feel as bad as I thought, or I was able to get through, my presentation on, I don't know, the Civil War, right, in history class, and I didn't pass out or say something stupid. Um, you can learn that anxiety will go down, and so orienting you to the right. This is a sort of the pattern that we'll see, right, with time on the bottom and anxiety on the y-axis, is that things that we might make us nervous or anxious, usually there's a rapid increase in anxiety, and then it kind of plateaus a little bit, and then it does go down over time, right? And so while our anxiety is going up, there can be this belief or thought. This is one of those thoughts that we might have that, oh no, I just got way more anxious. It happened really fast, and it's going to keep going up. But we know that actually sitting with that feeling, that over time it will plateau and then actually go down. And that happens through being exposed to that feared object or situation, and actually getting more used to it, right? Getting more used to it, experiencing it, is actually the remedy. Exposure increases our ability to tolerate that uncertainty, right? And so as we're supporting folks, and kids or students, patients that we work with, it can be really hard for adults to do this. It might actually even feel like kind of cruel or mean to have someone sit through something that is causing them real distress. And so we can have this urge to see this distress and be like, oh no, okay, yeah, that's too much. We can stop. We can get out of this, right? And so there can be this urge to like rescue while it's happening. And so one thing for us as adults and as providers, for us to practice is, how are we going to tolerate some of that distress that we might see, and kind of taking a few breaths yourself, sitting through it to see kind of what happens, right, while still supporting the student, or the client while they are going through being exposed to the thing that's making them really nervous. All right. So at the core, what are we doing? We want to, rather than avoid, we want to approach the thing that's making us nervous. And so that means doing the opposite action. This helps to strengthen those muscles, the skill set, right, about how do we manage this worry. And it's actually like a pretty simple thing to do, right? It's like, what is the thing that we're avoiding? We're going to find a way to take steps up to actually do the opposite, to go towards it, right? So it can be, in that way, I don't want to oversimplify it, but it can be fairly simple, relatively simple compared to some other things that other clinical strategies might use to figure out what to do. So you want to start by developing an exposure hierarchy. For example, on the right, it's really small, but I'll read what it says. This is where you might construct a ladder, right, of places or situations that you avoid. So at the top of the ladder, you'd put the things that make you the most anxious. And this actually is pretty easy to to identify, because like it's the thing that kids are thinking about. So you can put that at the top, and then at the bottom of the list, you can put things that you might avoid but don't really bother you that much, right? And then work to fill things in the middle. And while you're doing this, you can pay attention to what the kiddo is saying, and also what you observe. And a lot of times, especially whenever I identify things that go at the top of the ladder or really high in the ladder, you can see the anxiety, right? And so helping them kind of rank order, and even creating something like this is part of that exposure, and getting comfortable with that. So you can rate the different things that might be someone might be avoiding or causing them to be anxious, on like a 0 to 10 scale or a 0 to 100% scale. You should include, when we're thinking about what to do in terms of strategies, both imagining, the thing, doing something, this opposite action is a form of exposure. So like I said, even creating this is part of kind of like an imaginal exposure. In vivo means you're actually doing something physically, right? You are exposing them to the thing that's making them nervous. Maybe that's going into your history class, right? We're going to be giving a presentation later. So that's what we mean by in vivo. And then you want to approach these one step at a time. Start at the bottom, and or somewhere near the bottom, right, where they're experiencing some distress. And then systematically, we're going to work our way up. We call that systematic desensitization. All right, so let's give some examples about what opposite action can really look like. So let's say that in anger, right, is something that someone is experiencing, that can help us get us ready to attack or to defend ourselves, right, which sometimes is necessary. So the opposite of that would be to show kindness, concern, or walk away, right? Thinking about fighting, okay, we're gonna walk away, right? Another example is if, let's say, a kid is experiencing shame, and so they're ashamed about something they said in class, something, how they treated someone, for example, right? So they might have this motivation to hide, and to isolate themselves. So the opposite of how we might combat shame, doing the opposite action, is to raise your head up, give eye contact, shoulders back, right? And this is something that we can practice with them, before they're, actually confronting the thing that they might feel ashamed about. Let's say someone's experiencing fear, right? Fear can get us ready to run, to protect ourselves, or to hide from something dangerous. And so it serves a function of helping us to escape dangerous situations. The opposite of that is to go towards the thing that we are afraid of, assuming that it is not an imminently dangerous, situation, to stay involved in that, to get used to it, and to build courage in facing the thing that made us afraid in the first place. Someone's experiencing, sadness or depression, right? This can prepare us to be inactive, right? And so it can activate us to avoid contact with people, places, situations that we might need to engage with. So the opposite of that is to simply to get active, right? That's the opposite of being inactive. Disgust is something that helps get us ready to reject or distance ourselves. And again, this is whenever I see the bread that I've had for a couple weeks longer than I anticipated. I see a little mold on there, and I get that icky feeling like, that's good. It means that I'm not going to make that sandwich. It's going to get me sick, right? So that can be healthy. But when it's something that is getting in the way of me eating any lunch, for example, right, then that can cause some problems. So this might activate us to avoid situation. So the opposite would be to push through, get through that situation. And in this case, that I need to plan ahead to go to the store and buy a fresh loaf of bread so I can make lunch for myself. You can tell I'm hungry. Okay, guilt is something that gets us ready to repair a violation or to repair some harm that might have been done interpersonally. And so this can activate us to seek forgiveness. And so, or it might activate us to avoid the situation, right? That makes us feel that guilt deeply. So the opposite would be to apologize. And when we're apologizing, to really think about apologizing in a really meaningful way. All right, so those are the examples that I have. And just wanted to stop for a moment and see if there were any questions or any examples of other types of opposite action that folks have used before, or that you might use given some of the examples I gave. All right. Well, with that, I want to thank you for listening. I'm gonna shift it to Dr. Brewitt for our
Thank
next
you so
phase.
much, Dr. Holloway, for that presentation. Fantastic to learn about opposite action and patterns of avoidance. So we are going to shift to our case-based learning portion of our hour. So as always, thanks to folks who have video on, if more folks are able to turn video on, this is